Every one of us feels anxious sometimes. Some anxiety from time to time is even good for us. But for 6.8 million adults, we let anxiety affect our day-to-day lives and suffer from generalized anxiety disorder. Today I'll inform you about generalized anxiety disorder, some symptoms, tests, and treatment options for generalized anxiety disorder. Let's start off by looking at what generalized anxiety disorder actually is. Generalized anxiety disorder is exaggerated worry and tension with little or nothing to provoke it. A person may become overly concerned with money or health issues. You may have a payment due and become overly concerned with paying it. You may feel a lump in your throat and think you have lymphoma, or hear a stomach gurgle and think stomach cancer. A person may have a fear of impending doom, like the feeling of no matter how life is going great, something will take a turn for the worse, or in some cases, the constant fear of death. Now that you know a little about generalized anxiety disorder, let's take a look at some of the physical symptoms. Not everyone will experience the same symptoms of generalized anxiety disorder. One symptom of generalized anxiety disorder is difficulty concentrating. It could be so small that you can't concentrate on a test you're taking, or it could be so bad that you can't remember your pet's name. Some people say so zoned out that they are in a trance-like state. Another symptom of generalized anxiety disorder is fatigue. Even after a full night's sleep, you may be tired in the morning, or you may not have the energy to perform your necessary daily functions. One other symptom of generalized anxiety disorder is muscle ache. You may have a sore back all the time, but have done nothing to cause it. Your legs may be sore, but you have done nothing but sit on the couch all day. Now that we've discussed some symptoms, let's take a look at how it's tested and diagnosed. To help diagnose you, your doctor may ask you some questions such as, do you worry about events most days of the week for 6 months? Does anxiety interfere with your daily life and activities? Let's say you worry yourself sick about taking a test and can't go to school that day. That would be interfering. Another question the doctor may ask you is your anxiety related to anything else? Do you drink a lot to cope with your anxiety? Do you do drugs to help you make it through the day? Also, are you depressed or suffering from panic attacks? Lastly, let's take a look at some treatment options. There are several treatment options that are used to treat generalized anxiety disorders. Medications are used with great results to treat generalized anxiety disorder. A popular option is Prozac. Another common one is Paxil. Personally, Effexor has changed my life. I suffer from generalized anxiety disorder and it's helped me control it tremendously. Another option for treatment is psychotherapy. Psychotherapy will involve going to a psychiatrist. This person can help you make effective behavioral changes or teach you stress relief techniques. In closing, we learned a little about generalized anxiety disorder, some of the symptoms, and learned some of the treatment options. Generalized anxiety disorder can be serious and can affect our day-to-day lives, our well-being, and our physical health. If you choose to seek help, it is out there.